The genesis of this idea or this topic was I was a guest recently on a podcast called Super Age with David Stewart, which I highly recommend to anybody who's listening to us, not to listen to my part of the podcast, although sure, I'd love that, but more that he just has such a really great podcast. It's actionable, relevant information for anybody who wants to what he calls super age, meaning get the years pass by, we get better, or at least maintain our youthfulness and spirit and health as best that we can. And I love his approach. I love what he does. But on that podcast, he asked me about statins, and interestingly, afterwards, he said that was one of the topics that his audience really got interested in. Like there was a lot of controversy around statins, a lot of debate, and a lot of angst, and a lot of questions as well. And so I thought we would take this opportunity to answer those questions for our audience. And the title of this is, "Are statins bad for you?" So that's why I wanted to pick this, and hopefully we get some really good questions as well. Anybody who's listening in,
Yep.
We got off to a little bit late start here, but please leave any questions in the comments. Even if you're seeing this in replay or seeing this on our video blog, leave a comment, leave a question, because we'd love to hear from you and get your take on this. I say that around statins a little bit reluctantly, because people can be pretty one-sided on statins, either for them or against them. We are interested in here, not just dogma or unscientific things that are thrown out there as facts when in fact they're not. But we love to hear from you, and we'll just say keep it respectful on all parts. I'll do our best on that.
Sounds like there's a lot of people pretty thankful for this topic in the comments here.
Oh, good.
Yeah, we're excited. Definitely a controversial thing. I don't know as much about statins as you myself, but just seeing the comments on Facebook posts about statins and YouTube, I know it's a really controversial but important thing to talk about.
There's a lot of misinformation out there about statins, and it's not an uncommon thing for me to meet with patients and they come in with pretty definitive ideas about statins. It could be, oh, I really think this is the right thing for me, or I really don't think this is something that I will do. But once they understand the information from a less biased, I'd say nobody's unbiased, right? But less biased approach, and more given the choice, like rather than oh, you have to do it this way or you have to do it that way, more of a, hey, here's what we know, here's what we don't know, and here's the potential benefits and here's the potential risks, not the perceived risks. I think that's a real important aspect of this. Oftentimes people change their minds. Like I'd say 90+% of the time, once they understand the details of this, they'll make a decision that they didn't think they were going to make when they first came in. And so, I think that's a good place to start. There is people that are on far ends of the statin spectrum, and those are the most vocal and the ones that we're hearing the loudest. There's the ones that, in medicine, the kind of joke is the people that are big advocates for statins say it should be in the water, right? We should have statins for everybody because it lowers the risk of heart attacks, strokes, and death. On the flip side of that, we have people that say, oh, statins are poisons. They are, they're part of a pharmaceutical money grab. They're part of, medicine trying to medicalize everybody. They have terrible side effects. They kill the liver, and they cause dementia, and they cause diabetes, and all of these things. And is what probably most people would understand is the truth is somewhere in between. And that's what we're going to talk about today is, what's the real facts? What are the things that are myths? What are the things that are facts? And how can we use this information to ultimately take best care of ourselves? Like that's what we want, right? For us, our loved ones, We want to make decisions that help us live long and vital lives. That's my interest. That's what I want to do. I'm not going to make $1 off anybody taking a statin, I promise you. And in fact, I don't think anybody's making a lot of money off statins. They're mostly generic now. But the goals of people, you have to understand what they are before you take that advice. I would strongly recommend that as people are perusing the internet, looking at advice around statins, take the step back and say, who is this person? What's their credibility in this? And what's their angle? Because if they're saying to you, statins are terrible, but oh, by the way, here's my magic elixir, or on the flip side, they're just saying, oh, everybody should be on a statin. They don't know anything about you. And so they may be selling you their agenda and not necessarily what's best for you. So let's get started on this. So another part, a research study that came out recently that I thought was relevant to this was the study that looked at the number of people that have heart disease already. So these are people that have had heart attacks, they've had strokes, they've had bypass surgery, they've had stents, any or all of those things. These are people that we already understand are at the highest risk for future heart attacks, future need for stents, future deaths from heart disease. These are the people that we know are at the highest risk, and they're the ones that we want to be the most aggressive in prevention for those people. Every guideline around the use of statin medications would make a very strong recommendation that those people be on statin medications, because we have a ton of research evidence that the people in that category that have established heart disease or stroke, those people, when we've looked at research studies where it's placebo versus statin, the people that take the statins have a lower risk of heart attacks, strokes, and death. So anybody who has established heart disease, why would you take a statin? Because we know that it lowers the risk of heart attacks, strokes, and death. And yet this in this study, less than half of the people that had heart disease were actually taking a statin, 49.9% to be specific. And as we'll discuss, I think this is a real shame, because that means there's a lot of people that are at unnecessarily higher risk for future heart attacks and stroke than need to be. So to dive a little bit deeper into this, I want to talk about some myths around statins. And these are things that I've heard from my patients, or things that I've come across in our interactions on the internet. One of them is that we don't know enough about statins. And that is, well, maybe always true, right? Like, we don't know enough about anything, but here's what is a fact. Statin medications are the most studied medicines in the history of medicine. Like nothing else that I can think of has been studied as much. Usually if we have one or two really good studies, meaning placebo-controlled, randomized, well-designed, large population, a length of follow-up that's enough time to see if there's a difference. If we have one or two studies that show something as a benefit or harm, that answers the question. We don't really need to go any deeper. For statins, there are over 30 large placebo-controlled randomized studies that have been going on since the 1980s. Like, I was in high school in the 1980s. That was a very, very long time. So we have 40 plus years of experience with statins, millions of people. These are one of the most prescribed medications over all of that time. And we have a ton of information about statins. So it is not true that we don't know enough about them to make recommendations. Another thing I hear a lot from my patients is they're concerned about it being a potentially money grab from the pharmaceutical industry. Like, and I understand, like, I think being cynical about medications, particularly very expensive medications, is probably wise. Like, pharmaceutical industry has their agenda, right? You have to have your agenda in this. But statin medications outside of one of them are all generic now. They're about $3 or $4 a month, mostly, for statin treatment. So that idea that statins are, being pushed because there's a financial incentive to them doesn't carry a lot of weight. A third thing that comes up a lot is statins are dangerous, and statins, do have potential side effects. That's why I don't recommend that they be in the water. I think only people that are going to benefit from those statins should be on them, because there are potential adverse effects, but those adverse effects are often overblown. So the far and away the most common side effect from a statin is muscle aches, or the medical term is myalgias. About 10% of people will have muscle aches on these medications. Interestingly, though, when we do studies where people are taking a pill, but they do not know if that pill is placebo or a statin, they have about 90% of the adverse effects, the muscle aches and side effects that they feel from the statin, they're actually getting on the placebo as well. So probably there's a very strong component of our mind knowing that there are potential side effects to this medication. There's actually, I guess the way to put it is, there's adverse effects from just taking a pill, no matter what that pill is. It's called a nocebo effect. It's a very powerful effect. I don't know, how to put this all together for my patients when, except for to tell them, look, it may not actually be real. It may be something that is just your mind's kind of, leading you down this path. But the reality is, if you have the adverse effect on the medication, whether it's a placebo effect or nocebo effect or real, it probably doesn't matter. It's causing you adverse effects. But the real point is 90% of people take these medications with no difficulty at all. How about dementia? That's another common concern of my patients around statin medications. Actually, the evidence is that dementia risks are less in people that take statins, likely because it lowers the risk of stroke, and stroke's a common cause or etiology of cognitive decline. So statins, even with very low cholesterol levels, we don't have any evidence, despite lots of data that says that statins are a cause of dementia. Now, can somebody have cognitive issues on a statin? That's possible, absolutely. I will just tell you, my 25 years of being a physician, that's been a very rare occurrence, but something that again, everybody's individual and they have to make that decision for themselves. Another thing that advocated by the people are statin skeptics is that they don't really protect us from heart disease, that the statins are of minimal or no benefit. Now, I think this needs a little bit more, context to it. When we look at statin trials that have been done, they are generally 5 years or less. So recognize that you're taking a condition, heart disease or atherosclerosis, buildup of artery disease, that takes decades to manifest itself. So we know artery disease starts in the teenage years. But it can take 30, 40, 50, 70 years for it to actually cause a heart attack or stroke. These research studies are done over about 5 years, most of them. That's because they're too expensive to do further. Like they're about $100 million to do these very large research studies. But even in that relatively short time, we are still seeing that there is a decrease in heart attacks, strokes, and death in those people that take a statin versus a placebo. What happens, though, over decades? What happens over a lifetime? Well, we're never going to have placebo-controlled randomized trials that look at this, but we do have some evidence that suggests that effect grows over time, that it's like compound interest. A couple of things I'll just mention. One is something called a Mendelian randomization trial, meaning that we're just looking at people that have a genetically lower LDL cholesterol, which statin lowers, versus those people that don't have that. A small percentage of the population has LDLs that are just modestly lower than the rest of ours, maybe 30 points, 40 points lower than the rest of ours. Yet they have anywhere from 50 to 90% less heart disease. And it's possible one of the explanations is because they have those lower LDLs or seem modestly lower LDLs, but they have them for a lifetime. They don't have them for just 5 years. Maybe more powerful in this is because a genetic thing versus a treatment thing. Those aren't necessarily the same, of course. But one trial that was really impactful on me was a trial called the West of Scotland trial. That was done published in the 1990s. It was done in the 80s, and this was one of the early trials about primary prevention, meaning the people in the study were not didn't have heart disease already. They hadn't had a heart attack. They just had a high cholesterol, and they put people placebo or a relatively gentle statin medication 5 years, and they showed that there was a decrease in heart attacks and strokes in the group that took the statin. So kind of a landmark trial showed, hey, we need to expand this. We don't have to just wait for people to have a heart attack. We can actually head off heart attacks if we're aggressive for those people that have very high cholesterols. But here's what was really interesting about that. 20 years later, they went back and looked at those two groups. So realized that the only difference between them is that 20 years ago, half of them took a statin and half of them took a placebo. Otherwise, they're completely matched, like same smoking percentage, age, diabetes risk, all of those things. And after the trial ended, they were both sides where they followed them for another 10 years, and they were both sides equally likely to be on a statin after that trial. So the only difference was 20 years ago, half of them took a statin, half of them took a placebo. And yet there was still a 27% decrease in heart disease and a 9% decrease in heart disease deaths in those people. So the point being that taking a statin for 5 years, 20 years ago, still had this legacy benefit, still had this lowering of heart attacks and death in the group that took the statin for that time. And so, from my standpoint, I think that it's always going to be a balance of the benefits versus the risks. There's no absolutes in this. There's no absolutely 100% risk-free treatment, and there's also no absolute guarantees that you're going to get the benefit of that. You're really just playing the probabilities of this. And I would say that you take a step back. People that are particularly if they have heart disease, but if they have high risk for heart disease, and how do you determine that? Well, I think you talk to your doctor about that, but it's also your opinion as well. Like, I see patients who have family histories of heart disease. They don't personally have heart disease, but they know they're at high risk for future heart disease, or very concerned that they are. They're in, like, they already understand I'm at high risk for heart disease. Talk to your doctor though, get their insight in this. But if you are at high risk for heart disease, and you are at low, and you don't have side effects of the medications, I would say that you not taking that statin medications is putting you at unnecessarily high risk for future heart attacks, strokes, and death. And this is not a trivial problem, right? Heart disease, #1 cause of disability, #1 cause of death in the United States. Why would you not take advantage of proven therapies that can lower your risk, that have a low side effect profile? So anyways, I think this is a beginning discussion around statin medications. I would like to talk in more detail next in 2 weeks, Rylan. Let's talk about statin side effects. I'd like to go on a deeper dive on that and really understand what the research data tells us about statin side effects and how they help people. So, Rylan, any questions you have? Anything that from our audience that want to dive into?
Looks like no questions yet, but certainly anyone watching the replay or anyone watching now, if you want to type them, and we'll just get back to them later today. We'll shoot you a private message if you're comfortable with that, or just answer them here in the comments for everyone to see. Probably is better. Yeah. And yeah, I'm excited. I was gonna say we should touch on this again, just because this was a popular topic and an exciting topic. So we'll definitely dive deeper into statins. I think that's a great idea.
Yeah, so fantastic. I love talking about this topic, but I also love even more talking about how do we prevent heart disease? Like a lot of people are out there looking for answers. And I will tell you that there is really good evidence that relatively simple things, 10 simple things, what we call the HealthSpan 10, can lower the risk of heart attacks and strokes. I just did this research study or looked at this research study. And now I have the new number, Rylan. It's actually 92.5%. 92.5% decrease in heart attacks and strokes in people who optimize their metabolism, treat their blood pressure, their cholesterol, their blood sugar, their weight, and address their physical activity, their nutrition, their sleep, their stress, their toxins, and stay connected. That's what we focus on in our program. If you're looking for help in that, if you'd like to explore how we take our expertise in medical care and in how people do the things they need to do to improve their health, to achieve their health and longevity goals, we'd love to talk to you. Schedule a consultation, go to our page. Rylan will give a link out there. You can schedule.
I'll post it in the comments.
Yeah, you can schedule an appointment with us. We can talk about whether we're the right fit for you and how we can help you. We'd love to have a chance to discuss with you, because I will almost guarantee you there's a lot of opportunities out there that you may not be aware of. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.